There were many insightful takeaways from the Internet Searches for Opioids article. This article shed light on how Internet search data may be a very viable option in the detection of public health events. And some of the greatest advantages to using Internet searches, as stated by the article, are that these searches are already publicly available and much easier to gain access to than more private documents, such as any healthcare related bits of information tend to be. Another major strength about gathering data from internet searches is that this data would be coming from a source that is constantly being updated, providing researchers with real time information to work with. And although internet searches seem to be a very powerful resource to utilize, it is also important to acknowledge its pitfalls, one of which being sample bias. One example in this study is that not all Americans would be using Google as their primary search engine, and I think another big challenge to collecting internet searches is just handling the sheer amount of data in an efficient way. But with this challenge comes many opportunities for solutions, such as finding ways to utilize things like AI to make the search for keywords more precise and efficient.
As healthcare organizations start to develop big data analytical capabilities, there's starting to be a shift away from descriptive analytics towards predictive analytics. And predictive analytics can help assist in making important decisions in the clinical setting and getting ahead of potential health events in real time by estimating the likelihood of a health outcome by using patterns of historical data. And this type of data analysis is still in its infancy. However, if it is developed, it can have a huge impact on preventative health care. And if we focus in on the public health side and how predictive analytics can be potentially useful in public health forecasting, monitoring and predicting health outcomes through internet search modeling could be at the forefront of prevention, as mentioned in one of our articles. And as the opioid epidemic transforms itself into a growing heroin epidemic, it's prompted new methods to monitor any type of opioid use and prevent emergency department admissions related to opioid use, whether it's prescription or non-prescription. And as of now, the most viable way to monitor this at the moment is by monitoring internet search data and trends.
The benefits that predictive analysis fights for. There's also a couple points that I want to talk about that kind of go against the predictive analysis that I found in the article. So one point that can be questioned is biased. So it's best to know what model is being used, because if it was designed in a way that there was no sufficient samples for a certain population, or that certain population seems to have worse health conditions, then the results of the PA may worsen a patient's health equity, which goes against it. And with this bias comes conflicts of interest, and it is most likely that the physician will want to know what variables were used in creating the model. That can interfere with development of the algorithm. And so one final aspect to consider is the results of the PA and how it can compromise the decision of a treatment. The model can be recommending against an important procedure such as surgery or something that could be very vital to the patient's life, but because it's more beneficial for the population, then it could say, no, don't take the surgery. It goes against the physician and can harm the patient more than it can help them. So I believe that having a PA in certain clinical settings can be helpful and can lead a patient towards certain options and kind of pinpointing 2 or 3 final decisions, but the actual final decision should be made with the patient, with the physician, because that is the current concern. Having this PA algorithm going for the population can really harm the health of a patient, and relying on this technology can be challenging, and there is a limit to this new technology field on how it can truly help the patient in a positive way.
With today's technology, there are a lot of ways in which we can incorporate it into the health world. One of them being a preventative measure for opioid and heroin overdoses, and what Google has been doing is filtering keywords in counties to see what people are searching up. For example, Avinza, brown sugar, white, codeine, and these areas that have high search rates for these words have proven to have more emergency visits for opioid or heroin overdoses in the upcoming year. And if we are able to use this data correctly and filter out by counties, then more doctors can be mindful of the potential risks in these areas.